China has announced a major loosening of strict COVID restrictions that have been in place for the best part of 3 years.
Yeah, Beijing's zero COVID stance recently sparked an unprecedented wave of protests across the country. NBC News foreign correspondent Janis Mackey Frayer is in Beijing with the latest on this. So, Janis, what COVID measures are being eased here? What kind of changes are going to be going into effect?
The harder aspects of the COVID system are being lifted. Being able to quarantine at home, that's a huge step here. It removes the dread of possibly being taken away to a government facility, and that is something that has haunted most people during the pandemic so far here. Some of the measures were just excessive in the first place, like not being able to buy over-the-counter medicines like cough syrup, because authorities didn't want people masking their COVID systems. They're also reducing the need to test. Here in Beijing, we've had to show a negative 48-hour COVID test to get into most public places, so that's being reduced. And they're also trying to ease travel between cities. So while the bigger COVID system isn't being entirely dismantled, the government is changing how people use it.
What's the reaction been like, Janis, to these changes? Will they satisfy the people who had been protesting?
Look, these changes were probably going to happen anyway, but they do come after those extraordinary protests we saw that called for an end to the zero COVID policy and then grew into calls for greater political freedoms here. And that seemed to jar the leadership, though Xi Jinping hasn't said anything publicly yet about the unrest. What it does now, though, is the rules are being rolled back. It introduces a new anxiety, as most people are now having to confront the actual virus for the first time. We've had restrictions relaxed before, but the difference now is that things are reopening in a city like Beijing, and there's now COVID here. People aren't entirely prepared. Infections are going to surge. The healthcare system hasn't at all been tested. And there's also trying to get over the stigma of COVID. This is a virus that has been demonized here for the last 3 years. And now, over the course of a couple of weeks, the government is now telling people that it's not so severe and it's not something to be feared. So there is a shift in psychology that needs to happen at the same time, which is why it will be a bumpy road ahead as the pandemic enters the next phase here. And it's a phase where a lot of people are going to get sick. Joe and Savannah.
All right, Janis, thanks so much for your reporting.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.